Next we have our acute phase resistance exercises, and we're going to do the exercises today with the TheraBand, so you can see progression. Obviously we can do all these pushing into the wall. We're going to do flexion, right? So you can just hold, step forward, walk back, isometric flexion, isometric extension, and you probably get the point. Isometric external rotation, isometric internal rotation, isometric adduction, and then isometric abduction. Good. And then you can change whatever position you're in using the TheraBand. It's a good way to do that. Scapular retraction, active range of motion, just squeezing the band, or you can put the band behind the back, so you would use the station to make a loop. So I'm going to make this long band one continuous loop. Through the handle here. Always check, make sure it's secure. And I'll put it through around the shoulder blades. If you're really concerned about the patient, you can have their arms out, so there's still zero resistance around the humerus, and they're squeezing the shoulder blades. I like to have their hands in a little bit, so that we can get a retraction here. Just have them hold their arms in that sling position as they do it. You can do a scapular depression with the band just around the scapula as well, so there's no resistance on the glenohumeral. Where you're gonna go here, have them twist just a little bit, and then we get a depression, retraction just on the scapula. There we have our serratus activator supine. So with this exercise, you're gonna have them hug their body with their elbows, try to squeeze those shoulder blades up towards the ceiling. So squeeze your body with your elbows, inferior the angle of the scap towards the ceiling, and then you could advance this by adding a band in the hands for a shoulder external rotation, isometric and or concentric exercise. Next we have the hover push-up, which is our serratus activator and prone. So you're gonna go here. You want the hands down towards the hips, more or less as much as they can, and then lifting up. As they lift up, it's gonna pull that inferior angle of the scap down, activate that serratus lower trap sling. So we have our chin tucks and head nods in supine. So our chin tuck, well, we'll start with our head nod. Head nod is just the upper cervical flexion, just the chin towards the chest. The chin tuck is chin towards the chest, and then a lower cervical extension, so I'm pushing my head into the floor. Upper cervical flexion, lower cervical extension. And then our transverse abdominis in supine, usually best in hook lying, like so. And you just press your low back into the floor. Activate your transverse abdominis.